All right. Hello, everybody. It is Regan Archibald. And what if you could have a way to access unique states of mind, of finding peak performance, of really enjoying the way that you feel about your life and about yourself? What if you could actually just have better conversations with yourself? Would that change your life? Would that improve your energy, actually help you feel your best, look your best, and perform your best? Well, in today's show, we're going to show you some unique ways that you can access new regions of your brain, access what some say is, 95% of our life lives in the subconscious zone, all those areas that we don't really take accountability for and don't really understand the subconscious mind. But we're going to show you today how you can access this unique place with a couple of our amazing guests who I'll bring on in just a minute. So if you are looking for that upgrade in life and looking for a way to really accelerate your progress, today's show is for you. And so, but before we jump in, the Health Accelerator Challenge last night was a unique challenge because what we did is we kicked off our last decade of life as your best decade. And so the challenge we gave you last night is to start by analyzing the data. What most things get missed is we have these surprise attacks, these surprise diagnoses, these, we said, don't step in front of a bus. If you want your last decade to be your best decade, we want you to die young at a very old age. And so we said, look for surprises in your labs. And if you need help, reach out to us. So that's your challenge for the week. Next week, we'll continue on this new, this brand new 60-day challenge of how to prepare so that your last decade is the best decade. We're keeping people out of nursing homes. That's a big goal. So I'm going to introduce our guests today. We've got two of our favorites, and many of you know Dr. Bob Borelli. He's been at East West for years, off and on. He's been at the Park City Clinic down in Salt Lake, and he's just a phenomenal medical doctor who's got some unique training recently that we'll be talking about. And then we've got Dr. Stephanie Coleman, and Dr. Coleman is, she's a radiologist, one of the best, probably the best radiologist in the entire state of California. We're just going to give you that award, Stephanie. So, but also she's got some very unique background in helping people reach their peak state when it comes to their mental state, their emotional state. And this is Dr. Stephanie Coleman, also a medical doctor. So Stephanie and Bob, welcome to the show.
Hey, can you hear me okay?
Loud and clear.
Okay.
Awesome. Well, we're going to jump in and we're going to talk about this journey. But before we go, I'm going to, Bob, because a lot of people in our audience, they know you from services you've performed, but tell us about this recent transformation you've made in this brand new world of accessing the subconscious mind and helping people achieve greater states of health and well-being. And kind of give us a little bit of background on that. And if it's easier, we can start with Dr. Coleman. Let's start with you and give us kind of your background, how you morphed into this brand new area of medicine.
Yeah, so I mean, it's really exciting to do this work. So as you mentioned, I was trained as a radiologist, which I still do some degree of. But I've been working with ketamine and psychedelics for about 3 years now. So my journey really began with my own personal work. It's became very clear to me that as I'm working on my health and wellness, that the brain and the body are not separate, mental and physical health are not separate. And I started working personally with psychedelics probably 6 years ago or so. And to me, it just is why are we not doing this? Where is this fitting into our whole thought around health? So I got interested in doing the MDMA training with MAPS. I learned about ketamine, got trained to do ketamine. So I've been working in that space and have been trained in a number of psychedelics when they are available to us. But it's really beautiful work. It's relational work. I think that what we're looking at is treating disconnection in a number of ways from self and others. And that takes a huge toll on our physical health if we're not connected.
Man, well, I think that when, if you go back into the history of medicine, And we separated the mind and body like 600 or 700 years ago, so that the
Mhm.
Catholic Church didn't feel like medicine was infringing on its property, human
Yeah.
souls. And so it's pretty fascinating that now here we are, 700-800 years later, and we're finally bringing them back together. And that was one of the things that intrigued me about Eastern medicine is they never really departed, from the traditional medicine that I studied. There's no difference in that. Your liver actually has its own part of the soul that's has its own esoteric features. The lungs have their own esoteric features, the kidneys, etc. And so I think what you're doing is just bringing this beautiful bridge that's so needed right now. So I appreciate you being on, and Dr. Bob, let's hear kind of what's led you over this new bridge of transformation.
I did emergency medicine for about 25 years. And, in the beginning, it was so much fun. It was a learning opportunity. I think I helped a lot of people. But, in the back half of my career, I noticed a lot of people coming in to the emergency department with maybe physical complaints, but it was clear that these were issues with their spirits and their emotions and their mental health. And, I just knew there had to be a better way. So, I transitioned from emergency medicine into integrative health. And I had the opportunity to work with you closely. And, some of the best interactions I had with patients in 25 years were at your clinic. I personally started with psychedelics, I don't know, 15 years ago. But I would have to say that I attended a symposium through the Psychedelic Coalition for Health. I met Stephanie at a conference called Meet Delic, a psychedelic conference there. And then I did some training in ketamine-assisted psychotherapy. And since then, just so many opportunities have come in my life. And I've really seen this make the difference. And just the people that I've met and the lives that I've touched with ketamine-assisted psychotherapy, it's just been, I don't know, transformative for me. I'm learning just as much as anyone else, the client, the patient, and then the provider. I've never been in a situation where two people get so much just from coming together and being present and growing. So,
Wow. And this field it's emerging rapidly. I mean, it's one of the fastest growing sectors in healthcare right now. But I still think there's a lot of misnomers around there. There's a lot of myths surrounding ketamine. I mean, you hear the word psychedelic, and I think we all go back to the 60s, and it's like tripping out on acid and being like this crazy free for all. But really, from my experience with ketamine and the work you do, it's incredibly sacred. It's very professional. And it seems to be in a very controlled environment. I hate to use the word control because it almost sounds sterile, because it's not. But it's an opportunity where people can really access parts of their subconscious minds that they don't realize are holding them back. And I think that all of us, we have these subconscious belief systems that really limit our progression in life. And I look at psychedelics as a way of accessing those. But Dr. Coleman, what are your thoughts on that? And am I completely off on my interpretations?
No, there's so many things I can go from what you said. One being, yes, there's a lot of stigma around ketamine, right? And that's one rabbit hole we can go down. But something that you mentioned, like you didn't want to use the word controlled, and what came to me is that, like, when we are working with psychedelics in a way that's very intentional in creating healing situations or transformative situations, we pay attention to certain things. One being the mindset. So what are you thinking about? Where's your mind? What's the intention behind why you're going in to do this work? And the second is the setting. So the setting now, it creates safety, and not physical and medical safety only, but emotional, psychological, and mental safety, right? So people have the ability to be vulnerable, to get that into that space because they feel safe there. So without that safety and without mindset, and then the third one's dose, and that's a longer conversation. But that's where like those stories we've heard from the 60s, 70s, where people going crazy, jumping off buildings, or people having a bad trip, often those elements were not paid attention to. So yes, we are able to access things that we are not aware of, right? So as humans, we believe everything we think is true. If we think it, it must be true. And that's like our ego, and that's a survival technique. Yeah.
I
right?
thought everything
if I thought
it
it
was true. Yeah.
yeah, of course. If I thought it, it definitely must be true. But it works, except sometimes when there are things that we think about ourselves, it may have been a result of something that happened to our life, someone that's reflected something to us, some type of trauma we've had, but we believe it to be true. So those can be really difficult to disrupt. And what ketamine allows us to do is take us out of being in our ego, and take us out and have a different perspective. And it sounds really like minimal, but it just opens that window to what we think may not be the only truth. And that can be very powerful for people.
Wow. That is amazing. When I was in high school, I had a bumper sticker and it said, "Don't believe everything that you think." And so I think I think it's really,
you're on to something.
yeah, way early on, because I think I read this book called Inner Athlete that my dad, actually it was my mom that gave it to my dad to give to me. But it's called Inner Athlete, and I learned from Dan Millman how to visualize an outcome. And I was 13 years old. And the crazy transformation that happened to me is I learned how to meditate and breathe, and then I could accelerate my athleticism. I was never naturally gifted, but the only way I could get out of farm work was to make the basketball team, football team, track team. So I needed all the power I could get, and my mind was what accelerated it forward. So, so pretty fascinating. Dr. Borelli, what do you see, as far as, these psychedelic treatments, or as far as what are the big struggles that people are dealing with that they don't even realize that you talked about bringing two people together in this just real magical way. But what are the big breakthroughs that you're seeing, and the struggles people are having that they don't even know about?
There are a lot of them, but, over and over again, we see similar themes. Okay. First of all, there's a contingent of society that thinks everything's fine, only it isn't. They're not sleeping very well. Their relationships are poor. They're not where they want to be in their life. They feel like they're not good enough. They don't feel like they don't look the right way. They're not where they want to be. Those are the basic themes that we see over and over again. But what we're seeing breakthroughs in, just for example, a naturopath that we did a journey with, and she came out of that and was just, she said, her whole life she's had to be the caretaker. She's had to be serious, and she forgot how to play. And just coming out of that ceremony, she was going to work on being more playful. Just the look in her face, she looked 10 years younger, and she was incredibly playful. Sometimes it's hard to put words to these things, Regan, but everyone knows it when it happens.
I think you nailed it, though, because she has the realization that, holy cow, I've been a caretaker my entire life. I've never been able to play. It sounds like your dog wants you to play with him too, Bob. It's all good.
Regan, I wish I could say this is my dog. I've got a great story about this.
The dog is stalking Dr. Borelli.
The dog needs some ketamine.
Yes. Yeah, there's, oh, cute. Yeah. Bob, we're totally fine. It's a nice, friendly community here. So don't let it stress you. I love the insights that you're giving us. So Dr. Coleman, you've seen, you've worked with patients for years with this now. And when I talk to you about it, I can feel there's just like a sense of purpose behind what you're doing. And I really appreciate that, because I think we need more intentional doctors. I think we've taken the art out of medicine. And I think one of the beautiful things that happens with these psychedelic experiences, or these peak flow state experiences where people actually access a different part of their brain, is they can access the art part of life, the artistic part, which is like such a deep, like you don't know what's going to come out of this. Like the naturopathic doctor that you spoke about, Bob, she had no clue she was going to come out of this and have like, holy cow, I put myself in the box as the caretaker. I actually forgot to have fun. Like, oh, I just left so much energy and life on the table for how many decades. And it took what, an hour for her to have that realization?
Yeah.
I mean, in this society, we're taught to be individualistic. We're taught to be independent and to strive and to get things and to achieve. And adult, right? We're adulting. And part of that is that we forget how to make things fun. We forget that things don't have to be hard. So like we value hard, right? If we're not doing the work and if it's not hard, if there's no struggle, then like we don't value it. Like, did you really do it? Was it worth it? A lot of breakthroughs and a lot of really big things can come for people when they realize it doesn't have to be hard. Like, yes, we get to do things and we can break through things and challenge, but it doesn't always have to be hard, creating that ease. And we get to have fun and be playful, right? So like these like child parts of us that we like squish down and say like, no, that's not valuable. We need to be serious and we have to take care of people. And some of that comes from people's trauma. Like, so that's a real thing. And sometimes we just don't think that it's valuable, but that is like the value of life, right? Like, how do we do the things we have to do and also have fun? Because that's where, and when you talk about creativity, you think about kids, right? They're always like drawing things, making things, and no one ever knows what they actually are. And they're like, look what I drew. And you're like, oh, that's a nice elephant. And they're like, no, it's a house. And you're like, great. But they have no like no shame. They're like, yes, I'm going to draw. I'm doing the best job. I'm drawing outside the lines. This looks great. We lose that. And so, yes, psychedelics, because they allow areas of the brain to connect that on our everyday life, we don't allow it to connect. That it does enhance creativity.
Man.
So that's a very real thing.
I love that. I have a little magnet on the side of my fridge. I had to sneak it on there because my wife, everything is like perfect in our house, always clean. And but it says it's a Picasso quote, just to remind me. But he says it takes a really long time to become young again. And I think because we get trained to color inside the lines. I think that's a beautiful analogy, Stephanie, because I've never been good at coloring inside of the lines, and Bob's learned that about me pretty quick out of the gates. He's like, what are you doing here? But just allowing people the freedom to be themselves. I mean, by the way, we have AI that can duplicate anything we want. We can color inside the lines with technology, and now what we need more than ever are humans to actually show up as themselves. And that's two things I really love about you two, is because as medical doctors, you guys color inside the lines tighter than almost any other segment of society, because I hang out with a lot of doctors, and you guys are now just expanding your whole curriculum and the way that you think about healing and life. And when Bob, when you hit me up about this, it's almost been a year since you're like, hey, I'm on this journey, what do you think? And I'm just like super excited. But what's been the biggest change in your own brain through this process, Bob?
Oh, I'll tell you right away. You hit on it. It's the idea of control. Okay. And we can talk about this with clients and just personally. The idea that I would like to control everything we're discussing here today. The idea that I would want to control, the next 10 years of my life. That I would like to control everyone's psychedelic experience. And the minute I give that up, the experience is so much better than I could ever have imagined it. If I had a month to write down outcomes, it would never be anything. I could never even imagine all of the good and the positivity that's come out of relinquishing control. And just to dovetail that into what's a block from people using psychedelics to get better, so to speak, for improvement. It's that whole idea of not wanting to be in a situation where they're not in control, or at least there's the illusion of control. What happens if I take something and I fall apart? What happens if something goes wrong? I will not be in control. And so part of the beauty of what Stephanie and I and others do is we create this space with education, with interviews, meetings, and we create this space that when the day comes and you actually journey, it's such an incredibly safe space. There's so many people that they've never been in a space like this. And then they feel very comfortable letting that ego dissipate, leaving control alone, and just experiencing everything and learning from that. So the biggest hurdle I've overcome is just the whole idea of that I have to micromanage every little detail. I mean, Stephanie and I are definitely keeping everything safe, and we work very hard to create something wonderful, but it's not bordering on obsessive compulsive or anything like that. So
I love that. Well, I think the thing that Stephanie said early on too is, we're analyzing mindsets. So, for people to come work with us in this, it's, we're taking a very specific group of people who want a particular outcome. And I think that's really important. And we'll talk more about who this is for and who it's not. But then the second thing that you said, Stephanie, is, we're working on mindsets before someone ever enters into that sacred space or the pseudo controlled environment. But then instead of control, it's safety. So we want to optimize the safety so that you as a participant, when you go through that experience, you feel nothing but love, professionalism, nothing but safety around you so that you can fully relax into it. And I think that's a critical piece. And then the third part is that transformation is nobody knows what transformation that you need at this point of your life. But I can tell you, if you're somebody who is overwhelmed, if you feel like you're not showing up the way you want to show up in your relationships, if professionally you're at this stage of burnout or close to burnout, or if you're just really looking to reinvent your life, you said, hey, I'm a grandma and I want to serve my family better, or I want to actually start expressing who I really am. I want to get out of this box I put myself in. I think this is one of the fastest and safest and most incredible ways of getting there. And the beautiful thing about it, there's no dogma around it. It's not like there's some oath you've got to take. It's like whatever comes up from your subconscious brain is totally cool. And so Stephanie, what are some of the interesting things that comes up for people? You mentioned that naturopathic doctor, you mentioned that, Bob, but Stephanie, what have you seen in some of the patients you've worked with, some of the realizations?
Yeah, I mean, there's common themes in psychedelics for sure of people experiencing a greater sense of self-love, a greater respect or reminder of the love they have for people in their lives, a sense of connection to something bigger than them, bigger than humans. So that may look like God, that may look like spirit, that may look like energy, whatever that is for that person's belief system. Although I will say people's belief systems also can change, right? So people who didn't believe in a God or something bigger then do believe or have an experience of that. In general, ketamine does have an antidepressant effect. It does tend to make people feel better. There is some, this afterglow of psychedelics that happens. And we can talk about the effect of that versus the sustainability. But it's this sense that like everything's going to be okay. They have this knowing that like things are going to be okay, that they're exactly where they're supposed to be, that they are okay. And so you mentioned something about like people being able to show up as they are, right? So there's a lot of like fear around being who we are because of like rejection or abandonment and like it's not going to be good enough, right? And so how do we create real intimacy is like having people see us, right? So when people show up in my office and show up as they are, it's not only that's not powerful, but me witnessing it is really powerful for them and witnessing it in a safe way. So, right, they may have never had that where they've been accepted for who they are. And so that practice then allows them to go outside of this safe space and start to edge into that. I had this woman who I work with a lot of really successful, professional, like sometimes quite wealthy, but like very high functioning people a lot. And this woman that I had, she basically steps into companies as CEO, takes them over, makes them better, and gives them back. She came in, she started working, she wanted to control all the things like Bob talked about. She's like, I didn't like that playlist. I want to do this and I want to do that. And I'm like, okay, so I'll lean a little into that, give you a little bit of control, not all of it. And then by like the third session, she looked like a different person. Like she was just so softened, and not in a weak way, but in a like human way. And it's sometimes hard for people to always recognize their stuff, like how they've changed, but what they see is other people reflect it back to them. So people they're in partnership with or people they work with. So the way she changed was reflected in her workspace. She actually stepped away from her job for a year to figure out how she wanted to be, and then recently went back into it, and she approached it in a completely different way, because she just can't imagine doing things the way she did them, because they were coming from a place that like really didn't exist anymore in the same way. So people really can alter their lives and make huge decisions, which we also encourage not to do right away because of that. I've seen people that no longer experience anxiety, that were riddled with it. And these are people that were doing the meditation, doing the yoga, paying attention to nutrition, doing all the things, but still had this like sense of like dread over certain things. And I saw it like melt away. Like, you know what? Things are still going to come up and things still may be hard, but I know it's all going to be okay. And that's like, it sounds so subtle, but that changes people's lives.
Yeah. Well, I could imagine as, in her state, like her brain's in these kind of alpha theta state where she's constantly got this drag and trying to be creative, but also has this like, this expectation of control over companies. I could imagine going in there with a little more creativity and vulnerability. That's what I saw when you explained her, is her heart just opened up, and vulnerability is one of the hardest things. I actually didn't really know. My wife would always say, it was our anniversary last night, and I have the best wife in the world. She's amazing. We had a great time. So I know I mentioned to you guys when we were texting last night, I'm like, I'm sorry, it's my anniversary, but
that's so good.
But vulnerability, I think, is that's something that I've really struggled with. And so you see it just kind of crack people open, where they feel like it's okay to be a softer human.
Especially for men, right? So she's a female in a very male dominated position. So she has to work in masculine energy. But in this society, we teach men that it's not okay to be vulnerable, or that it's weak, right? And so, and there's a lot happening between the men and women's space and white males and all these things, right? But what I see is that like men need healing. Men need a safe space to be vulnerable, because most men have been taught their whole lives that that's not okay. So yes, women also we all need to be vulnerable. And it's hard and scary. And that's what we model, right? So in our setting, what we create safety is that it's okay to do that. And that takes sometimes a little while, right? A few sessions, because we're asking people to step into something that not only feels really uncomfortable, but has been taught to be like not okay for a long time. So oftentimes I'm challenging people's ideas of what is it to be a man or masculine, and what does it mean to be feminine, and how are those viewed? Because the best that we do is the integrated masculine and feminine. It's not one or the other in all of us.
Well, and I think vulnerability is kind of the bridge where you can be it takes complete masculinity to be vulnerable and say, hey, this is not working for me. I don't like the way that you're treating me, or I don't like the way where things are going. Or you can be completely vulnerable in the feminine aspect and say, hey, I really love you. I really care about everything you're doing. And I just want to give you a hug. I had a patient yesterday. Are you a hugger? I'm like, yeah, of course. And so she gave me a big hug. It felt so good. And I love that kind of thinking. And so, Bob, I know you have deep relationships with our patients at East West. What do you find happens when people go through an experience like this? What happens to their own inner dialogue? Maybe they're less critical, or what do you notice?
Right. I always wonder, in my past life with patients, why aren't people taking their health seriously? Why is that not a priority?
Mm.
And then, it's not enough, the old model of, hey, you need to lose weight. Hey, let's get these cholesterol numbers down. Hey, fill in the blank. But nobody listens, or they do for a bit and then they stop it. Is it because it's not interesting to them, or they don't see immediate results? So I find that after people go through an experience like this with ketamine, and maybe they do a lot of prep work up front, right? Some things that they'd like to get out of this. Why is health important? Why do you want to lose weight? Why are these things important? And then you go through a journey like this, and all of a sudden, people start to look at themselves differently. They want to be around for their daughter's wedding, for example. All of a sudden, health becomes a priority. It comes from within. There's always the the traditional doctor-patient relationship where, it's paternalistic, so to speak. You're telling someone what to do.
Yeah.
What happens if that could just come from within? And it just, their health, it comes from within. Their whole biology changes. They get better. They're doing work externally, sure, running, eating less, fill in the blank.
Yeah.
But within them, their body is actually changing now because of this. And it's amazing to see people blossom, so to speak. It's amazing.
Yeah, I love that. And I think you bring up a good point, which is, the people who we want to help with this. And, we have amazing humans in our community. And I've been speaking about, the retreats we're going to be offering at East West. And so I think this would be a good time because, you kind of mentioned it, like people who want to blossom. Who is this for? Who are the ones that could really benefit from? And then let's talk about maybe who we need you to do some more foundational work on your health before you enter into an experience like this. But whoever, Stephanie, Bob, either of you can kind of take this on. Who is the ideal person that we can help in these journeys?
Yeah, I mean, I think, you always have to think about like, who are you working with, like as a provider? Like providers also have different skills, right? So, for myself, and I don't want to speak for Bob, but I work with a lot of people who are very high functioning and very motivated, right? So they've likely done a lot of the other things to help their health and wellness. And then they realize something's still not right. Something's still, they're not happy, or they keep kind of falling back on things. So it's looking at, when we talk about why people don't do certain health things, there's beliefs in there about like what they can and can't do and who they are and who they aren't. So we can disrupt those. This also can be for people who kind of want to take things to the next level, right? Like maybe they've done all of the physical things and now they're like, what's left for me to kind of accelerate or to explore, or how do I transform? Really like relationships. This also does help people who are struggling with anxiety, depression. Especially we've seen that a lot with the isolation that came from COVID, that people are probably they can function over it. So it's not necessarily debilitating, but when we took away that kind of function for a lot of people, they were at home and not being able to do as many things, that perhaps these symptoms came out more, right? And so people who just want to optimize the way that they feel about themselves, they want to turn down the inner critic voice, right? That's saying a lot of things to them. People, and again, there's varying degrees, right? So this also helps people who have severe depression, suicidal ideations, complex trauma, PTSD. And it's just knowing like who you want to work with, because certain providers have different skills. For me, it's really more, I tend to work with a lot of the high functioning people that are very motivated and curious. And I'm just kind of disrupting some of those thought patterns to kind of help them excel a bit more.
Yeah. And I think, I think in our retreats, I think you mentioned it, if you're coming because you've got like schizophrenia or manic depression or anything that requires, psychiatric medications or help, this is not the environment at East West. Our environment is really, we're looking for people who they want that next level of thinking and that next level of health when it comes to accessing your subconscious mind. Because one of the things that we just kicked off last night is, imagine that you could live the last decade of your life and it's the best decade of your life. I'm sure Bob and Stephanie, you guys have been in nursing homes and you've experienced what it's like there. I'm like, what if we could just start like priming everyone in my community to say, well, let's help you avoid that. Well, the only way we can help you avoid that is if you're doing everything to keep your mind, your body, your spirit, everything optimized. And so I think this is a massive shortcut. And we talked about emotions last night and how emotions are such a driver in our human physiology, and they can really help you in manifesting far greater levels of health. You know, you can go slug it out at the gym every day, but if you're miserable and you're grumpy all the time, and if you have negative outlooks on life, you're not going to get near the benefits as you would as if you're a positive person. And so, so this is for those of you who are ready to go to the next level. And so if you have addictions, address those. You can do that one-on-one. But in our group setting, we're looking for people who are really ready to take it to the next level. So
I just want to say something about the group too, when you mentioned that, because, you know, there are studies showing that people who don't have connection or partnership or community actually die earlier. They die younger. And so doing this in a group, that powerful element added of connection with other people is really strong. So like, that is an actual accelerator of health and longevity, is by having these deep connections. And there's one of the great grandfathers, I will call him, he probably wouldn't like that, of psychedelics, Stan Groff, is like 90, mid 90s, I think, forget exactly how old he is. He originally did 4,000 LSD therapy sessions, like with patients before it was illegal, but he's probably done more psychedelics than anybody that's alive. And he's like 90 something years old, had a stroke, and like is intact and better functioning than most people.
that's
So that's
amazing.
just a plug for psychedelics in general.
Wow. Bob, any thoughts on this?
You know, I would just say that it's really important for people to get out of those ruts that we all create as we get older. The negative speak. You know, if you look at the world around you, if you turn on the TV, even things that are supposed to be enjoyable, it's all fear-based and just negative thoughts. And that grates on you. That creates this low-level stress. You've got this low level of cortisol that's always firing. You're on guard, you know, and that weighs on people. And they wonder, why am I tired? Why does my knee hurt? Why does my low back hurt? Why do I have headaches? Why do I need to drink so much coffee? Why am I taking all these pills? You know, this is a way to, as Stephanie said, just disrupt your thoughts, you know. You maybe start fresh. And it's not just taking ketamine in a vacuum and sitting at home, you know, it's everything that surrounds it. You know, the educational opportunities we provide with our words, with creating the safe space, with the recommendations for reading. There's things you can watch. And like Stephanie said, the idea of being in a group and doing this and looking around you and saying, I'm not alone in the way I feel. For me personally, when I know that I'm going through something with people that feel the same way, that have the same problems, that just makes it so much better, you know, and we can grow from each other. You know, that whole idea of community, you know, erasing those deep grooves, disrupting those thoughts, and growing. How do you grow after college? Dumb luck, school of hard knocks. You know, how are people growing? How do you get better? You know, this I'm excited about this. You know,
Man, I love it. And you know, growing, I always look at it as you've got to add skills. You can always add skills to your life at any age, but you have to increase your character traits. So we can always be better humans in some aspect or another. And then the third thing is getting rid of the false beliefs, because I think in life we end up loading up false beliefs. And one of the things that one of the books we have our patients read is Be Your Future Self Now by Benjamin Hardy, which is a phenomenal book, but it talks about like, what do you want your life to look like 10 years from now? And then how can you pull that into the present and just do those things very quickly? And I look at this process as helping you be that future self, because you remove the hardest thing, which is to remove, and those are the false beliefs. It's the things we don't know that we believe in. And the things that we believe in most are the ones that we'll never let go of unless we actually have an idea of why we believe it in the first place. So such a powerful concept. I'm so excited about this. And just so everybody in our community knows, we've already started compiling a list. And so many of you on the show today, and as you listen to this on a podcast series or on YouTube, we've already got names of several of you. But for those of you who are ready to go to that next level and you say, man, I would love to be a part of this, I'll tell you a little bit about how the retreats go. And then you can submit your application to us. We're not, we're not accepting everybody. So we will give you a group that we feel you're going to be the best with. And so you'll have an experience where Dr. Coleman, Dr. Borelli will come in. You'll meet with them first so that they can make sure that everything is going to be safe. So we optimize safety. They're going to analyze your mindsets. Why do you want to do this, and help you really define your goals. And then at the actual retreat, when you come in, you'll come in as a group and you'll get to know each other a little bit. And then you go through the experience. But then when you come out of that experience, you'll have an integration session the next morning. You'll have one that night, then we'll have one the next morning. But then we're going to take you through some very cool things when it comes to health. So we're going to help you access your subconscious mind, but this is where we'll go through some of our tools, like the Fitness 50 tool. I'll be training you on how to understand your blood labs in entirely new fashion. We'll show you exactly what markers to look at when it comes to longevity and where the bottlenecks and where the big threats are. We'll also be teaching you how to optimize your nutrition. So we'll have Chef Hillary come in. You'll hear from Andy. You'll hear from Jenny. So we're going to have an entire workshop that's prepared for you. So it's going to be pretty amazing, because we're going to work on the physical body, the mental body, and then of course the energetic body in ways that has never been done before. So I'm excited. So if that feels to you like, wow, this could be life-changing, all you need to do is text the office 801-582-2011, or just send us an email and we'll get you on the list, and we'll put you on our application process, and they get you with Dr. Coleman and Dr. Borelli, and we'll go from there. All right. So,
and also, a side note, just ketamine also works on the physical by creating new connections in the brain and actually repairing some of the neurons in the brain. So it does both.
You were mentioning that with, and let's talk about that real quick just as we finish up, but BDNF and making the brain more, the more plasticity you have in the brain, or the more that your brain can change, the less likely you are to develop neurodegenerative diseases. And so maybe just talk about that a little deeper, Stephanie.
Yeah, so there's actually some research going on with different psychedelics on neurodegenerative disorders, particularly looking at like Parkinson's and Alzheimer's. But so basically there's this system called the default mode network, which doesn't allow certain areas of the brain to connect while we're like normal and waking hours so that we can actually function. It's useful. We need it. Ketamine or any psychedelics, we believe, takes that system offline and then allows areas of the brain to connect that normally don't. And on a more like cellular level, what's happening is that we are actually stimulating pathways to help support and build new connections in the brain so that we actually physically have those there. And we have some studies for ketamine also showing that some of the cells that have been damaged by inflammation, by anxiety, depression, or other, are actually getting repaired. And so like they are now sprouting more dendritic spines, and I'm getting a little bit cellular, but than they did previously. So ketamine is doing multiple things, and we imagine probably all the psychedelics are doing multiple things. We just don't know them all yet. So there is an actual physiologic component happening. And my belief is that if we're creating these new connections, well, we have to work them, right? We can't just like go to the gym once or like, eat healthy and then stop eating healthy. For me, it's like anything, it's a practice, it's a lifestyle. It's like, we've built these connections. Now the integration is how do we work those connections?
Yes, I love that. And that's exactly why we have, 2 days where we will be with each other, actually putting some things into motion. So once again, it's a shortcut to, achieving that peak state. So, so I'm super excited about this. It's one of the breakthroughs that I see as the future of medicine, and you guys are bringing it right into the present moment, which I appreciate your courage and your open-mindedness to this. And so, so any final words of wisdom from you, Dr. Bob or Dr. Stephanie?
Yeah, there's so much we can talk about here. When we keep talking about safety, ketamine has been around for, I don't know, at least 50 years. Okay. It was used in Vietnam. Most of my career, every day when I went to work in the emergency room, I would give people ketamine for pain, for shoulder dislocations, to sew up lacerations on children's faces. And what we always marveled at was just how safe this drug was. And then the whole idea that there's a whole area of research looking using functional MRI and how ketamine actually grows, new neurons, heals neurons. There's never been a better time to do something like this with ketamine. The whole ketamine assisted therapy it's amazing because so many people are looking at this and studying it, and there's an explosion of information that's been very positive. And then just Stephanie and I, just our personal experience and with the patients and clients we've worked with, it's just been amazing. It's been easy. How often can you say that? It's just been an easy experience. And this is coming from the guy that did emergency medicine for 25 years. It's easy and exciting. So that would be my final words.
Man, I love that. Thanks so much. How about you, Stephanie?
I think it's Rick Doblin who says this, the director of MAPS, or founder of MAPS. He says it's a human right to explore our consciousness.
Wow.
That we all have the right to do that. And, to me, it's bigger than even just health and wellness, right? It's bigger than us. And we have that ability to create humanity in a different way. And so I have a very idealistic goal of what psychedelics can do for humans and humanity. But for me, doing this work, I just feel like it's what I'm meant to be doing. And yeah, I don't have to I'm not doing, I'm providing, and I'm holding space, and I'm empowering people to learn how to heal themselves. So yeah, and in comparison to traditional medicine, the way we work, it is easy and it's fun, and it's really humbling. And I recognize that people allow themselves to be the most vulnerable they've ever been in my office, and I take that very seriously. That's sacred space for me. So I look forward to continuing to do this, and hopefully I could continue to do it for a long time. Thanks for having us.
I think you've got a pathway. We're going to keep you guys doing this forever. So we just got to make sure you guys live for another 200 years and we're good. So I just need that in writing.
Yeah, no
problem. This partnership is forged for good. So you guys are amazing. That was such an incredible show. And I appreciate everyone in this community for being open-minded. If you made it this far, I know that you guys are, you're people who are eager to transform yourself and eager to explore what exists under the surface. You'll be amazed at what you'll find there. So much love, so much joy, so much intelligence, so much life that exists under the surface. So if you're interested in applying, all you need to do is send an email to info@acueastwest.com, text or call the office 801-582-2011, and we will get you connected at either our next retreat or get you connected with Dr. Coleman and Dr. Borelli so that you can actually have the experience of knowing who you are for maybe the first time in your life. So Dr. Bob, Dr. Stephanie, thanks so much for being on. Really love and appreciate you guys.
Thank you for having us.
All right. We'll talk soon. Take care. Bye-bye.